To examine a patient with neurological issues, you are going to first test their conscious proprioception. This is going to be if they are standing up, you're going to turn one of their paws over and they should quickly turn it back over. You are also going to check for ataxia or incoordination. You also want to check for voluntary movement of the legs, especially the hind legs. Are they weak? Do they just fall over? Or can they stand on their own? Or can they not stand whatsoever? You are also going to examine skin pain by doing a toe pinch. For a regular toe pinch, you are just going to use your fingers and you are going to pinch the toe and they should draw it back and react. You are also going to acknowledge deep pain, which another would do it, is the toe pinch where they will have no reaction at all. They will acknowledge the pain by example, maybe vocalizing or looking at where you did the toe pinch, but they will not have a reflex or a withdrawal. You should also look at their mentation. It can either be normal, they're wagging their tail, they're happy. It can be dull, they're still doing pretty good, but they're a little out of it. They could be stuporous, where they're pretty out of it, but can still do some things on their own. They're obtunded, where they're pretty much, they need help moving everywhere, they can't do anything. And comatose, which basically means they are not unresponsive in any kind of ways. To check the cranial nerve reflex, you're going to want to throw something, for example, this clip, and throw it over there in their vision and see if they look to find it. You are also going to use a bright light and check in the pupil and see if their pupil reacts, either dilates or constricts. For a spinal nerve reflex, you are going to do a toe pinch as well, which we already discussed. You can also do a toe pinch using a hemostat. So you're going to do it and put it on the toe and do it a little farther. You can also do the patellar reflex, which is where you're going to tap right here and they should have a little kick. To care for your animal once they have been examined and everything is done, you want to make sure to turn them over every 4 hours as they do receive pressure sores. We do not want that. You should record their excretion, both urination and defecation, and they should be on grates or water beds. They should not be on something solid because of those pressure sores. To move an animal, a large animal, onto a hard surface for transport, you are going to grab them by the scruff. They were already in this position. You are going to make sure to keep the back and neck straight and lift them onto the surface. You are going to use something like rope or Velcro to hold them down and transport them while making sure they stay straight. Whether this has to be with more than one person, which for a large animal it usually will be, and keep them straight no matter what happens. For a small animal, you are going to want to do something very similar. You are going to want to, especially with a head injury, you're going to keep them here. The difference with a small animal is you can actually hold them. So you can keep their head in, place your arm along their back, and make sure that the back and head does not move. If they just have a lower spinal injury, for a small dog or cat, you can hold them like this so their bottom is hanging down as long as the back stays straight.